Welcome to the Workforce Connections podcast, where we discuss workforce development in Southern Nevada. Here's your host.
Hi, and welcome to another episode of the WC podcast. Today, we have a very special guest, my fellow board member from the Las Vegas Global Economic Alliance, Mitch Cloward. Welcome.
Thank you.
Mitch, you are the region president for Intermountain Health. We're excited to have you today. On our podcast, we usually start by sharing with our audience where you were born, where you grew up, went to school. Perhaps take us to your first job after graduating school.
Sure, absolutely. So I grew up in a neighboring state, Utah.
Nice.
I was born in Bountiful, and I grew up in northern Utah in a small town, Kaysville.
Wow.
And I learned a lot of things that were important that helped shape my life in Kaysville growing up in a small town.
Wow. What was the population there?
Population was probably a couple thousand.
Oh, wow. Very small.
Yeah, very small. And I learned the importance of helping others. I learned the importance of when you gave someone your word, you honored it. I learned the value of just caring about other people. And it was fantastic. Those values still are instilled in me this day, what I learned growing up in a small town.
That is awesome. And you did all of your elementary, middle, and high school in that town?
Yes.
Wow.
Yeah.
You left for college?
I left for college. Yeah.
Where did you go?
So I went to Weber State University in Ogden, Utah, not too far,
Okay.
northern Utah as
Yeah.
well. And then when I graduated with my bachelor's degree, I wanted to become a hospital CEO someday. And so there were no master's degree in healthcare administration. So my wife and I left for Houston, Texas, and we were in Texas for about 9 years before moving back to Utah.
That's really cool that you had that vision that early, because in my profession, there's not many people who say, I want to be the director of a local workforce development board, you know?
You know, I remember a dinner conversation with my dad when I enrolled in college.
Wow.
And I was scared and confused. And I asked him, Dad, what do I do? What advice do you have for me? And he asked me some questions. He said, is there an industry or a field that you particularly are interested in? And my mom had a cousin that was a hospital CEO at the time. And I said, well, I'm kind of curious about hospitals. And he said, then go work in a hospital while you go to school. So I applied for a job. My first job in healthcare was a housekeeper in a large hospital.
Wow.
And I loved beginning there. I've learned so much since then.
That's cool. I'm sure that now when you walk through a hospital, and they probably don't know that you've actually performed that role, but you understand it perfectly.
I understand it perfectly. And here are the things that I learned from that experience that defined my career. I worked in a very busy intensive care unit. So there were a lot of physicians and nurses and caregivers. In healthcare, we typically refer to our employees as caregivers. And so I was surrounded by people. And it was a trauma hospital, and there were a lot of very, very sick people in the intensive care unit. And so I was surrounded by them. And I knew that what I did, Jaime, was important. I knew that the protocols that I followed to clean the rooms, to keep the patients safe and free from infection was important. But I didn't feel important, and I didn't feel like I was a valued member of the team. No one really ever talked to me until a room needed to be cleaned. A patient in room 32 is being discharged. It needs to be cleaned. And I never forgot how that made me feel. And so I remember on my last day of work distinctly thinking two things. One, I love hospitals. I'm going to do whatever it takes to become the CEO of a large hospital someday. And I'm always going to value and care deeply about everyone that works in healthcare. No matter who you are, what you do, you're important. Because I didn't feel important, and I knew that what I did was important. So even to this day, everybody that I work with, I care deeply about.
That's a great story, Mitch. I worked in hospitality for 20 years, and when we were about to open a large hotel, whether it was the Mirage, Treasure Island, the Bellagio, we were always told tonight's going to be full of expensive champagne and food and things. I said, but people will forget what you say. People will forget what you do tonight. People will never forget how you made them feel.
Right.
And so you're absolutely right. I think that walking into a restroom in a casino and saying good morning, and the porter doesn't even react because the assumption is they're not talking to me. I'm nobody. I'm over here just doing my job. But I remember, good morning. And finally they say me. I say, yeah, you, good morning. And so that's awesome. As a CEO, you have that philosophy.
You never forget how it makes you feel, do you?
Yeah. That's amazing. So Mitch, now thank you for sharing that part of your story. Fill the gaps. After Houston, there's a lot of professional pivots and moments that you, till now, as the CEO of Intermountain Health. Take us a little bit through those years. What were some milestones, some major decisions that you made that got you from there to where you are today?
Yeah, so after I graduated with my bachelor's degree, I found myself in Houston, Texas, working for a large multi-specialty physician group practice. They had a lot of clinics throughout the greater Houston area. So my first job was a financial analyst. And I was doing that while I was getting my master's degree. So after I spent a great deal of time as a financial analyst, I wanted to be out more with people. And so I was given the opportunity to go out and be a practice manager and run a couple of Kelsey-Seybold clinics in the Houston area. And I loved interacting with patients and our caregivers. And then from there, I moved to Dallas. I had my master's degree and I started working for a health insurance company. And I loved learning about how we pay for healthcare in this country, all the dynamics that come along with it. And I got the opportunity to interact with a lot of people, a lot of hospitals, a lot of clinics, to contract for services for members of our health plan. It was about in 2002 when I was living in Dallas when I got a call from Intermountain Health in Utah. And I was offered a job only about 2 hours north of here in St. George, Utah. Wow. And so there I was able to get experience in a hospital and eventually I achieved my dream. Wow. That was when I achieved my dream in St. George of becoming a hospital CEO. In Intermountain Health, we call them hospital presidents. I became a president for about 7 years. And then I had the opportunity to become our regional president and move here to Las Vegas. I live here in Las Vegas. I love Las Vegas. But I also, as part of our region, which is called the Desert Region, it's the state of Nevada and Southern Utah. So I spend most of my time here in Nevada, Las Vegas, but I also spend time in Southern Utah because Intermountain Health has many services there. So my background is in running hospitals, health insurance, and large group physician practices.
That's so cool. For those who don't know about Intermountain Health, what makes it unique, different from other hospitals? Is it only a two-state company? Is there more? Can you tell us more about Intermountain Health specifically? Yeah,
let me tell you a little about our origins. They start in Utah, Salt Lake City. They start with the Church of Jesus Christ of Latter-day Saints, who owned and operated in the state of Utah, one in Idaho, hospitals. And there was recognition within the faith that they were growing worldwide. They had members of their church throughout the world. Yep. And they recognized that they couldn't afford to provide health care for all of their members. So they decided to divest these hospitals and formed a not-for-profit entity that became known as Intermountain Health. And the origins there stem from a commission, who we've become, centers from a commission that came from the Church of Jesus Christ of Latter-day Saints, which was to become a model healthcare system and to care for those who sometimes don't have the ability to care for themselves. So that's deeply rooted in our not-for-profit mission, where we take care of every patient who comes through our door, really regardless of their ability to pay. So, and that focus on quality and safety and patient experience are all ingrained in who we are and what we do, even to this day. And we are a model healthcare system for the country. And even internationally, our reputation spreads. But it starts with, Jaime, really one patient at a time, one experience at a time.
Thank you. I didn't know that at all. Yeah. So I love learning those details here in the podcast about a company that, I thought I knew, but here we are knowing it was born out of the church. And I've always said, people by their works. And the one thing I admire about the LDS church is, they really put into practice that about take care of the widows and the poor. And,
right.
that is, the works are there. You see them.
Absolutely.
That's great. The hospital is just another manifestation of that. Desert Industries is another way that I knew.
You're right.
In the financial world, Camorra Credit Union, it's like they really materialized, these things that you should be doing.
Very real. It's very real. Yeah.
That's awesome.
Yeah.
So now I think everybody's excited about what your company is going to build here, the first standalone comprehensive children's hospital. Tell us about this project. How significant is this investment? How significant is it for our community? And how's the process going?
Yeah, I think the significance stems back to how many children, Jaime, have to leave the state of Nevada every year to receive complex health care. And the estimates we're not definitively known, but estimates are as high as, 50,000, as low as 30,000 children have to leave the state each year. And you think about how disruptive that is. And I've had the opportunity to meet so many children and their parents and their families who have been disrupted by a very serious, scary diagnosis. And so it's a very common theme that it's disruptive in that it's scary. My child was diagnosed with something I don't understand, but could be very serious, could even be terminal. So you have to understand the realities of how daunting that is and how scary. Then you think about having to leave the state. That's time away from family. Yeah. It's time away from work. And so I've met parents who are working 2 jobs, Jaime, to afford to be able to leave this state once a month to travel to California, to Utah. We learned about this primarily through our children's hospital in Utah, Primary Children's Hospital in Salt Lake City, where we noticed that there were a lot of children coming from Nevada. And being the hospital president for 7 years in St. George, Utah, only 2 hours north of here, we learned that when we had a very sick child, that there wasn't a dedicated children's hospital here in the state of Nevada. So you think about the impact to families and individuals and children, how significant that is, the financial impact. It's incredibly disruptive for so many reasons. So we believe that we have world-class entertainment here. We have world-class dining, world-class sporting teams and events. We believe we can have a world-class children's hospital. So Nevada does not have a dedicated children's hospital. There are adult hospitals that care for children, but not a hospital that only cares for children. When I say children, Jaime, I'm talking about from birth to about typically 18 years old. And then you have all of these physicians and caregivers and specialists that all they do is care for children in one location. It is going to be significant generationally. And we have an opportunity to have a tremendous impact on every one of these children.
Wow. I can't wait for you to be a part of the conversation. I think we briefly talked about it at the LVJA meeting last time. Councilman Brian Knutson here from the city of Las Vegas, the medical district is his ward 1, they call it. And he is just as passionate as you are about this idea of what do we do so many families don't have to leave? And he's one of them. He's one who had a child who needed care. The president of Toro was there, same situation, a child who needed care, and they still have to leave. And so this group of folks, including, the presidents of UNLV, Chris Heavey, Nevada State University, which now has a new president. They all, Stacy Klippenstein from CSN, we were all there. Joan Ebert, who's on the Workforce Connections Board, our Clark County School District Superintendent, talking about this aspect. And so I can't wait to have you join that group and really be a part of this long-term thing that we need to do together as a community to build the talent pipeline for this hospital.
Absolutely. And I want to compliment, and Intermountain Health wants to compliment all of the physicians and caregivers who have cared for children in Nevada for so long. Hospitals, physicians, regardless of who you are, what you do, if you care for children, our gratitude is extended. And especially in the gap of so many deficiencies of things that are missing here to care for those children, which requires them to have to go out of state. So first, we want to thank those who have been providing it for so long in the face of so many gaps and holes. We want to work with them. And then we also need to recruit more physicians, more medical and surgical pediatric subspecialists who aren't here, in large part because there's not a dedicated children's hospital. So So that's our approach, is to really work with those who are in town to find ways to collaborate and also to recruit nationally and sometimes even internationally to recruit the very best physicians and caregivers to help us bring these children back home.
Can't wait. Sounds like a great project. Where will it be located, Mitch, geographically?
Yes, off of Durango and I-15, really, over in the UNLV Harry Reid Research and Technology Park.
Okay, right by Blackfire.
Southwest, yes, exactly.
Wow.
It's a great location.
Yeah.
We have a lot of individuals on our team who've studied demographics and where children live and accessibility, and we believe in the southwest portion of our county here is the right place to build this hospital.
Yeah, very accessible, as you said, and visible too.
Visible.
Yeah,
absolutely.
Awesome. So the industry is evolving, Mitch, very rapidly. There's, it's being affected by technology, robotics, AI now. Yeah. So what are some of the both challenges and opportunities that you see in the healthcare industry? Yeah,
so if you think about it, Jaime, can you think of a gift in life much greater than our health?
Yeah.
So I just think, and I've worked in healthcare now for over 30 years, and I've been around a lot of people. I've been around a lot of very sick people. And so the first thing that I think is so important for us is to care about ourselves and to make a commitment to improve your health, to set goals. And one of the best ways that you can achieve those goals is to establishing your care with a primary care physician. So typically that's a family practitioner or an internal medicine physician. It's important that you visit that physician at least once a year, right? That you have lab work done, that you have a coach and a mentor, someone that can help you be healthy. So one of the challenges, Jaime, in healthcare is getting access to a primary care physician. Here in the state of Nevada and across the country, it can be a challenge. Who do you call? Do they have availability? So access to primary care can be very challenging. And access to seeing a specialist. Let's say that over time you're diagnosed with a heart condition or, heaven forbid, some form of cancer. Your primary care physician needs to refer you to a specialist. And so, Jaime, sometimes it can be difficult to get access to those physicians who provide the care. So we all need to be involved in being aware of those shortages. Academic partnerships are going to be critical for us. When these students go to medical school, where they do their residencies and their fellowships, there's a good chance that we can get them to stay here rather than leave the state. So partnering with academic partners is going to be critical for us to attracting, retaining, and recruiting the very best caregivers and physicians. So access is going to be really important. Affordability. Affordability is a real challenge in healthcare, right? So we've got to do a lot more to help make healthcare not only more accessible, but more affordable. Now, you mentioned AI. Like, what part of our lives isn't being impacted by that, right? You just think about that. And so I think about the possibilities. And so there's so many ways that we're starting to integrate that into what we do in healthcare to improve the health of the people we serve. Intermountain Health's mission is to help people live the healthiest lives possible. So a simple way that we're trying to ease the administrative burden of our nurses and physicians is dictation, documenting what they do for and with a patient. And so we have technology that is able to listen to and assess the dialogue between the patient and the caregiver to document what's happening in real time. That saves time. Physicians and nurses still have to review that documentation, but anything we can do to make it easier for them to care for patients through artificial intelligence is going to be significant. Another thing that I think personally for me that I would want that's possible now too is that I have a lot of history with my health. Every one of us has a story and a journey with our health. My primary care physician has all of my medical records, and he knows a lot about me. What I see happening in healthcare is also a colleague, an artificial intelligence colleague my physician can partner with.
Wow.
That all of my medical records, all of my tests, all my health history and information is gathered through this artificial intelligence interface. And so we talk about physicians historically having the ability to walk down the hall and consult with one of their physicians. They can still do that. But think about the ability to have a consultation with an AI-like physician.
Wow.
That it assesses all of my family history, all of my tests, and it helps derive summary information, a diagnosis, a possibility. And so I think that our physicians are going to have more help and support. It's not going to replace the need for a physician, but it could help really increase the speed and accuracy of the diagnosis to have the ability to have artificial intelligence assess that information and surface information and recommendations too. Again, we want to make sure that decision is still in the hand of the physician as the captain of the ship, but all of that information can be helpful doing that even better and faster.
Fascinating.
Yeah.
So, Mitch, Intermountain is known nationally for innovation. What kind of emerging technologies or care delivery models are you excited about for the future?
Yeah, absolutely. I want to talk about some things that won't change, right? And that's fundamentally how we care for patients, right? And so that requires two really important skill sets to do that right, starting as a foundation that we can never compromise or step away from. So when we hire caregivers, we need to make sure they have strong technical and clinical skills so that the patient has a good outcome and to keep them safe. But on top of that, it's also really important, Jaime, that we have caregivers that deeply care about the patients we serve. So I think about the words compassion and kindness and being friendly. On top of those technical and clinical skills, those things together, we know create the very best experiences for our patients. And let me share with you one example. It was during the pandemic when I was president of the hospital in St. George, and I received a 2-page single-space letter from a patient. This patient was in our hospital for about a month. And this patient talks about being diagnosed with COVID and really was resigned to the fact that they were going to die. And we're working through that mentally, just resigned to the fact that I'm okay with that, it's going to happen. And the letter talked about this caregiver that would enter his room every day. And that caregiver was a housekeeper. And in hospitals, we have these whiteboards to communicate with our patients. And so this housekeeper would interact with this patient every day and offer words of encouragement and write words of encouragement on the whiteboard. And I don't know how many days in it was into this patient's stay that the things that this housekeeper was saying and the things that this housekeeper was writing on the whiteboard suddenly started to give this patient a desire to fight, to live.
Wow.
And so in the letter, he credited the housekeeper with saving his life. It wasn't the housekeeper's clinical skills that saved that patient, but rather it was the kindness, caring, and compassion that was displayed, the love that was showed that gave this person the desire to fight, on top of the great clinical care that the patient was receiving from our physicians and caregivers. That is remarkable to me.
Yes.
It's remarkable that we can never step away from caring deeply about those we serve. And we can never step away from expecting our caregivers to have the right technical and clinical skills. So I want to start there. We talked about the power of artificial intelligence and to innovate there, right? To make it easier to provide care for our patients. And, you know, there are patients who, we all know stories, as good as physicians are and as well-trained as they are, there's sometimes patients whose conditions is still an ongoing puzzle. So I think as we incorporate our medical history and medical records into caring for our patients, it can help supplement the information that our physicians have to, again, I think, increase the speed, accuracy of the diagnosis process, faster, more effective. There's different ways we can continue to innovate. There's a lot of administrative complexity in healthcare, and there's a lot of expense in labor. And so if artificial intelligence can replace areas in healthcare where there's excessive labor or redundancies or waste, we are all for that, because the money at the end of the day that we get comes from our patients. And so we're trying to find ways to take complexity out of healthcare, to simplify it, to do things at less expense, but yet greater outcomes. So I think think about billing processes, and you think about all the labor that goes into that. I think a lot of those processes that are heavily manually required can now really be supplanted or sometimes replaced with artificial intelligence that can do these things automatically. And again, we don't ever want to replace the natural connection between humans. But there's ways that we can simplify and reduce the cost of care to make it more affordable by automating things that historically have been done by people.
I'm at least me, I think our audience too is going to be much more now knowledgeable of what makes Intermountain special, because you're describing, again, I didn't know until today that it was a faith-based institution. And that's a lot of times where it's easier to find compassion, care, kindness, empathy, so that's awesome. Now, you talked about workforce and labor. Many employers can't find enough quality labor today because our country has had a steady decline in birth rates, has had a steady decline in immigration. The largest generation in history, the baby boomers, are all to retire. And so we have all this compounding issue of, where are we going to find the workers of tomorrow? How does Intermountain look at that picture of attraction, training, retaining employees?
Yeah. So think about just the Children's Hospital here. And Intermountain provides more services than Children's Health here in Nevada. But think about what it's going to take to staff a hospital. I was a housekeeper.
Yeah.
We have to have housekeepers. We have to have nurses. We have to have physical therapists, speech therapists. We have to have rad techs, medical technologists. I mean, the list goes on and on. I know that to staff this hospital, we're going to need probably 3,000 people or caregivers. Some will be as needed. Some will be part-time, some full-time. But I think when you think about groundskeepers and everyone that's going to take to staff a hospital to be open 24/7, it's daunting. It's challenging. And so what are we going to do? Well, I think that's going to require us to focus locally. It's going to require us to focus regionally. It's going to require us to focus across the state and even across the country and even internationally.
Wow.
To attract and recruit and retain the very, very best. And we want the very best because our patients deserve the very best. So once you get employed with Intermountain Health, there is an array of resources within our organization to thrive and grow and advance your career. Think about me, my journey. I'm from housekeeper to regional president. I mean, that's the kind of possibility that exists with every caregiver that comes into Intermountain Health. So there's ways to help pay for education. There's learning opportunities within our organization to learn just about anything you want, not only in healthcare, but there's other resources to help you learn more broadly than that. So career advancement, we want to know what every caregiver's aspirations are. We talk a lot about servant leadership at Intermountain Health, and that is selfless devotion to not only our patients, but to our caregivers. And so I have open conversations with members of my team that work for me by saying, Jaime, what are your dreams and aspirations? And a lot of employers, a lot of my bosses in the past have been afraid of that question because it's almost like it's an open invitation for them to take another job. It's intimidating, and we know how much it costs to replace somebody.
Yeah.
But they're going to leave no matter what. I've had bosses in the past that I would never have told I was leaving in 2 weeks because I would fear that I would lose my job sooner. I'd be forced out, right? It's just the reality of the situation. I've had bosses that I've felt completely comfortable with saying, here are my dreams and my aspirations and my goals. And they embrace me knowing full well that I could leave. But you know what? I'm going to leave anyway. So why not create an environment where we can foster learning and development and growth? And oftentimes we can retain them within our own organization because of opportunities there. So I think servant leadership is all about caring deeply about our caregivers and fostering their growth and development as well. And in a large organization, look at all the different types of jobs that exist, and not only Intermountain Health, but any healthcare organization here in the state of Nevada. There's so many possibilities for someone who really wants to learn and grow and develop and advance their career.
Well said. And it's daunting to think about what it's going to take to staff that new hospital in the future. How about today? You talked about those opportunities. What would be some specific opportunities of somebody that today wanted to get into the healthcare field, into a career in healthcare? Can you give us a few examples of what's available today?
Yes. So there is a common theme amongst caregivers that want to work in healthcare. Those that stay, and here it is. It's quite simple. I mean, there's something about that caregiver, that person that cares deeply about helping other people. So when I think about our connections back into the school system here, that's something that I think is important, that there are people that really want to help other people. Those people typically do really well in healthcare. So what can you do? You can get a job at Intermountain Health. You can get a job in another healthcare system. Start somewhere. Because starting somewhere is the first step to going somewhere else. And, you think about, I was working as a housekeeper in a hospital, going to school. And so I started thinking about networking within our own hospital and within our own healthcare system to say, geez, maybe someday I want to work in finance, or I want to do something else. And so what happens is, as you advance and grow your experience and your education, doors open to other possibilities, even within the same other organization, or even outside of that organization, in another healthcare system, that you start to learn, grow, and develop, and develop skills and strengths that healthcare employers want and need, which increases your value over time too. So it's as simple as starting to apply for a job, any job, an entry-level job, getting your foot in the door, demonstrating that you care and that you add value. And then that opens doors to other opportunities and other avenues to achieve your goals and aspirations.
Well said, Mitch. And now I'm going to throw you what they call a little softball for you to hit a home run, because I've seen you say this, answer this question at the Las Vegas Global Economic Alliance, where we're talking about broader economic development and what we need to do as a community. And so how does a strong, well-prepared healthcare workforce contribute to the broader economic development of our community, right? We've been hinting at it, and you're very passionate about it. So why is that important to economic development?
Well, let's just think about the construction project itself. This is a project that's just over $1.1 billion. On the entire campus where this hospital is going to be built, we're approaching almost 1 million square feet of facility space. So you think about Penta as a local construction company, partner with Jacobson that's out of Utah. Those are two construction firms, and you think about the number of employees that they have.
Yeah.
Then you think about the subcontractors they have. We're talking about a lot of people that have to be here. This is a project that's going to take 4 years. We are going to break ground later this fall.
Wow.
It's going to take 4 years to build this hospital. You think about all of the construction workers in all of their varieties and specialties of things they do. We're going to be bringing a lot of people here. They spend money. They buy food. They shop. They have to have a place to live. There's tremendous economic benefit. And entities like the Lindsay Institute and the Trip Umbach study, they quantify the impact. In fact, I have an estimate here, $724 million projected statewide economic boost during construction. $841 million in annual output once it's open.
Wow.
You think about, I was talking about, Jaime, estimating about 3,000 caregivers to staff the hospital. They need a place to live and shop. So the economic impact is significant locally, regionally, and across this state, even across Intermountain's footprint as well in the six states that we serve. But you think about tremendous economic growth and development here just in the state of Nevada in the Las Vegas area is tremendous. Yeah. And it's a significant part of what we're doing here.
Can't wait. The project sounds more and more exciting the more you educate us about it. Let's shift gears a little bit because we've been talking about your professional life and economic development and healthcare. But I know that when you're not working hard at the hospital or volunteering at the LVGA or another board, like any other human, you need to recharge your batteries. You need to refill your cup and re-energize. How do you find ways to do that? Is there hobbies, activities that you and your family enjoy that recharge you?
Yeah, I care deeply about my health. You know, I lost my father when he was 67 years old to colon cancer, and there were things he could have done to prevent that. There's things his physician could have done to prevent it. So I also, Jaime, one of the reasons I care so much about my health is when I was the hospital president in St. George, every Christmas Eve, our hospital would purchase poinsettias, plants. And I and a few members of my administrative team would, on Christmas Eve, deliver a poinsettia to every one of our patients.
Wow.
And I can't forget those people. And I can't forget the people who were fighting for just one more hour. And I come back to just how much that inspired me to start thinking about my own health. So it's a personal journey for each one of us, and I really encourage all of us to think about committing to improving our health and establishing our care with a primary care physician. But what I do is most mornings, like this morning, I live, in Summerlin, and I live close to where there's mountain bike trails out in the mountains. So I like to be all alone, and I love to just ride my mountain bike, and I love to think, and it's hard, right? I don't have an e-bike. I have a manual bike where I'm pedaling, and it's very therapeutic for me. It helps me connect with nature. It helps me connect with my faith. It helps me connect with my thoughts. There are a lot of people that I'm accountable for in my region, our caregivers, thousands. And so it helps me think about them and to be centered. But it also helps my health. And it helps me think about what I eat, how much I eat, when I eat. And so that helps me be a healthier person. So that's what I love to do. And I have 5 children.
Wow.
Some people look at me and say, Mitch, you have 5 children? Yeah.
Wow.
And I have 3 grandchildren.
Wow.
So I have 2 boys and 3 girls, and I have 3 grandchildren from 2 different daughters.
Wow.
June was just born 2 months ago to my daughter Bailey. And Mallory, my oldest daughter, has Olive, who's 6 years old, and Russell, who's 3. So I just love spending time with them.
Yeah, they keep you busy. Wow, that's amazing. Mitch, as you were talking about young people, I often think about my 18-year-old self and how, if I had the wisdom that I have today, back then, I could avoid that guy a lot of pain, in his life. Yeah. But then I remember also that guy probably wouldn't have listened anyway. He was such a knucklehead. So we like to end our podcast with a question that maybe draws from your experience. Obviously, you've also learned a lot in your journey from housekeeper to CEO. What advice could you give? What golden nuggets could you give somebody, a young person who's 18 today and saying, I relate to Mitch. I also grew up in Utah and I love healthcare and I believe that empathy, compassion, care, kindness is some of the gifts that God gave me. What advice would you give them that could help them be successful and have the type of journey you had?
Yeah, I think that the first piece of advice that I would give is to be kind and caring and considerate and compassionate of other people. We live in a society today that's so polarizing that I grew up in a home where that was important to my mom and my dad, and I'm grateful they taught me to care about everybody. So care deeply about people around you. Care about your community. Give back to your community. Find a place where you belong. Oftentimes when people come to me for advice, I start in a very different place than they think I normally would. And I would say, your journey about your career is first about a journey about discovering who you are as a person. What do you like? Mm-hmm. What do you dislike? What scares you? What inspires you? What motivates you? Find who you are and then find a career that matches those strengths and talents so that you can give back to our communities. That's the starting place, right? And that's hard. And we see people who go from career to career and they're still on that journey, right? But I think the most important thing is care deeply about people, respect people, love people, understand who you are, understand your talents, your strengths, and find a career path that best matches those and thrive and grow and work hard and give back. To me, is so inspirational. And as part of the journey I continue to be on, right? I'm learning more every day, and I've worked in healthcare for over 30 years. Wow. You never arrive. Yeah. But that's the journey that I highly support and one that I've been on and continue to be on.
It's very inspiring. And I've learned a lot today. I know we talked about this a couple of months ago. You're a busy guy, and so your schedule, we've had to wait, but I want to tell you the wait was worth it. I've learned a lot about you, your philosophy, your company. And so, again, I want to thank you for taking the time out of your busy schedule to come and do the podcast with us today.
Thank you for all you do and for the Workforce Connections. This is significant work. Fantastic.
Great, Mitch. Great to see you.
Likewise.
Well, that's it for another episode of the WC Podcast. We want to thank the crew that makes things happen here behind the scenes. We want to see you at the next episode. Until then, stay safe. Mitch, thank you for staying over to do our bonus segment called In the Hot Seat. Are you ready?
I'm ready.
All right. We're going to start with the favorites. And favorites, I'm going to give you a category. You'll give me your favorite thing in that category. Let's start with an easy one. Your favorite food.
I love Thai food.
Favorite beverage with dinner.
A classic Coca-Cola with real sugar.
Favorite dessert after dinner.
Tiramisu.
Favorite way to start your day.
Riding my bike.
Favorite way to unwind after a long day.
Watching YouTube.
Favorite hobby or weekend activity.
Hiking.
Favorite vacation spot.
Bear Lake, Utah.
Favorite holiday.
Christmas.
Favorite car you've ever owned.
A Porsche Taycan Turbo S.
Favorite college sports team.
Brigham Young University.
Favorite professional sports team.
The Las Vegas Raiders.
Awesome. Sandra's going to be happy. All right. You made it through the first segment. The second one gets tougher. Hence, we call it Tough Choices. Are you ready?
Yeah.
I'm going to give you two things. Now, again, hopefully you can pick one, but we'll forgive you. You can pick two if you want. All right. Waldo the Wildcat or TW's Oakley the Owl?
TW's Oakley the Owl.
Awesome. Vacation or staycation?
Vacation.
When you go there, fly or drive?
Drive.
When you get there, hotel or Airbnb?
Airbnb.
When you retire one day, will it be in the ranch or in the city?
In the ranch.
A day by the ocean or hiking in the mountains?
Hiking in the mountains.
Have more time or have more money?
More time.
If you were a superhero, the ability to fly or breathe underwater?
Fly.
The ability to speak with animals or speak any foreign language?
Any foreign language.
Here's where it gets really tough. We're rounding the corner. Are you ready?
Yeah.
Pick one or the other. Truth or kindness?
Okay. Truth.
Actions or words?
Actions.
Justice or grace?
Grace.
You made it through tough choices.
All right.
The final segment is called Finish the Sentence, and I'm going to give you about 90% of the sentence. You're going to finish it for me. Are you ready? Mitch, if you could visit any place in the world, it would be?
Normandy.
Oh, awesome. The best part about living here in Southern Nevada is?
The people.
Your favorite thing about your job as the region president for Intermountain Health is?
Are caring for our patients.
If you could travel back in time to any year or any period, you would travel to?
1986.
Ooh, I got to ask you.
80s.
Oh, awesome.
Just the 80s,
awesome.
Right? Everything was great in the 80s.
Very good.
Yeah.
3 words that describe you, Mitch, are?
Kind, caring, and compassionate.
I couldn't agree more. Doing the WC podcast here with us today was?
Inspirational.
Awesome. Well, Mitch, thank you for staying over to do the hot seat.
Yeah, thank you.